Now more than ever, where you live and who is in charge impacts your health. In terms of COVID-19, the US leads the world in the most cases and deaths. Not to mention, life expectancy in the US is approximately 36 compared to other countries globally, and it is decreasing. 50 years ago, we were in the top 5. Life expectancy is a vital sign of a nation that reflects population health. The US also is seeing an increase in maternal and childhood mortality. Only 8 countries in the world saw an increase in maternal mortality between 2003 and 2013, and the US is one of them. You might think that personal behaviors are responsible, but while this has implications, this is only looking at the tip of the iceberg. Japan, for instance, has the highest prevalence of males smoking cigarettes, yet is ranked number 1 for life expectancy. Women while pregnant in Japan are encouraged to smoke during pregnancy to maintain their weight, yet they're still ranked number 1 in the world for life expectancy. So, what could this be? In terms of high income countries, the US has the most inequality and has been increasing over time. A lack of social investment is fueling the growing inequality and the health outcomes associated with it. Compared to other high income countries, the US by far has the lowest ratio of healthcare to social spending. The US spends the most on healthcare in the world as a percent of GDP, yet is simultaneously having these dismal outcomes. This points to the fact that health does not equate to healthcare. The US is one of 2 countries in the world that does not have required federal paid parental leave. The other is Papua New Guinea. It has been shown that healthcare makes up about 10% of the determinants of health, while social and political factors make up 40%.
These issues are deeply rooted societal problems that manifest everywhere, and our home state of Washington is really no exception. An example is regressive taxes. Regressive taxation is when poor people pay more in taxes than the rich as a proportion of their income. This often happens when you have a sales tax, in which you are charged an amount based on the price of something you're purchasing. Naturally, this amount will be a large proportion of a poor person's income compared to that of a rich person's income. If you had to guess which state in the entire US has the most regressive tax system, which one would it be? You guessed it, Washington. Regressive taxes are inequitable and tip the economic scales in favor of the already wealthy. They work to cement and exacerbate societal stratification by trapping people within their socioeconomic status. Studies have shown that those lower down on the socioeconomic ladder are more likely to have maternal complications and less likely to have healthy gut microbiomes. These people also experience greater levels of stress, which in turn are linked with issues like heart disease. As a society, we typically address these problems by telling people to make better personal choices, eat healthy, exercise, don't drink, don't smoke. However, this evidence indicates that maybe instead we should focus on tackling inequality to improve population health. Here are a couple ways that Washington lawmakers are trying to do just that. The first is by rebalancing Washington's tax code by implementing a capital gains tax, which would affect the wealthiest Washingtonians. This tax would apply to the profits made above a given threshold by selling highly valued assets. This capital gains tax is currently in the legislative process as Washington's House Bill 1496 and Senate Bill 5096. Another effort to rebalance the tax code is Washington's House Bill 1297 and the accompanying Senate Bill 5387, which expand the working families tax exemption. This working families tax exemption is a rebate that puts money in the pockets of Washington's poor families and reduces their tax burden. Another way that Washington legislators are working to fight health inequity is by protecting early life. Much of a person's lifelong health is determined in the period of time between conception and early childhood. Hardships and stress in this period can lead to bad health decades into the future. One solution currently in the legislative system is House Bill 1213 and its companion Senate Bill 5237, which expands our state's early childhood development and affordable childcare programs. Another is House Bill 1073, which expands our state's paid family and medical leave program. This program allows family members to take time off work to care for a new baby without losing their whole salary.
If what you heard in this video is a problem to you and you want this legislation to pass, then contact your legislators. This is an opportunity to save lives and to break the cycle of generational inequity that's affected marginalized communities. Go to https://leg.wa.gov/lic/pages/hotline.aspx, link in the description, and click the District Finder link under Find Your Legislators, then select your county on the map. Then go back to the previous page and either use the link to the email list page or the link for the office addresses and phone numbers and search for your legislators. Sending an email can be just as simple as saying, "Please vote in support of this bill. Public health is important to me, and I believe that this legislation will improve public health. So please take the time to make an impact on your legislators." More details about the bills mentioned in this video can be found in the links below. This video is made as a part of a class at the University of Washington in the School of Public Health. If you have contacted your legislators or will contact your legislators because of this video, it would help us out immensely if you could click the link to our Google Forms survey in the description. It's only one question and it helps us measure our engagement with the public. Thank you for watching our video.